you.
Thank you so much. I want to sincerely thank Denise and everyone else in the agency for having me on. I am on from Florida, so it's good to be with the people in England. I have to apologize for some of the noise behind me because since I'm at the house and they decided to cut the grass prematurely, there may be a little bit of noise, but I'll do my best. So again, my apologies. I really enjoyed the presentations before me, and I would like to take it to another step when it comes to people's hesitance about the vaccine. One of the things that I like is that the idea that people not taking the vaccine means that they are against it is just a farce. People not taking the vaccine could be not right now, or maybe I need a little bit more of understanding. And what I have found out myself, looking at a lot of millennials, because I teach at Morgan State University in the program of public health, and I teach doctoral students. And so we've been kind of pondering over this idea of people of color, especially Caribbean people and other immigrants in the United States of color, not taking the vaccine. Is that really true? What we are finding is that it's not necessarily that they don't want to take the vaccine, but the attitude among quite a few of them is not yet. And not yet meaning because I don't understand how taking the vaccine is going to help me with my socioeconomic status, with my current health issues, and with other health disparities that we constantly read about, where we are always number one. And so some of the hesitancy comes not because they really don't believe in the vaccine, but they're saying, well, what is this going to do for me now? How is taking the vaccine going to help me to pay my rent? How is going to take the vaccine going to help me get more education? Do I get access to education so that I, just like everybody else, have an equal opportunity to educate myself so that I can become better, so I can become better in my finances, better in education, I can take better care of my family, and in doing all of that, also address my mental health, because in doing so, I will reduce the levels of stress that constantly make me go nuts when it comes to paying bills. And that's just really putting it plain down to earth, nothing fancy. What is this vaccine going to do for me? Because everybody is promising things, and there's so many promises about everyone taking the vaccine, but what we've seen in the past is that when we all are part of the group, if you will, and we get the same treatments that everybody gets, we're still not getting the same treatments. And what do I mean by that? In about 2003, I was working on Capitol Hill. We were writing health policy, and we were looking at this document called Racial and Ethnic Disparities among in healthcare among minorities in the United States. It was written by Dr. Brian Smedley. This report has become sort of the Bible for looking at health disparities on Capitol Hill. And what we find is that when we're talking about health care and we're talking about people's general health, we're confusing two things. We're talking about health care constantly, but we're not talking about health. When we're talking about health care, yes, everyone has access to the vaccine. Everyone has access to testing. But when it comes to health, we don't have access to the same things. So if we're talking about getting people vaccinated, then people of color are saying, well, after I get vaccinated, I'm still going to be in the same socioeconomic condition that I was in before. I'm still going to have unequal pay. I'm still not going to have the Whole Foods and the Trader Joe's that you have access to so that I can get better nutrition. And my kids still don't have to go to, my kids still cannot go to the better schools and get the same education that your kids are getting, so that we can actually further ourselves educationally and that we can get the same opportunities in the job market. So after I've taken the vaccine, I'm still in the same condition. I still don't have access to health. I have access to health care, but I don't have access to those factors that dictate my health outcomes. And because of that, I want you to tell me, this is from the people saying, I want you to tell me how that's going to help me. So if you can give me those answers, I'll go and take the vaccine. But if not, you're not giving me much hope. The only thing that I can say is that I've taken the vaccine. And then the other thing also, because of the fact that there's not enough data to show that we can truly create herd immunity based on the fact that I'm going to be part of the game, then I'm going to hesitate. Now, I took the vaccine. The reason that I took the vaccine, I live in the 55 plus community. I'm sorry, I'm moving my phone. I live in the 55 plus community. And what we decided was that a group of us, Caribbean people, I'm from Suriname, we decided that the 6 of us, we wanted to get together. We also wanted to respect each other's health, but we also wanted to make sure that we protected those around us and that we reduced the risk of ending up in the hospital across the street. We did not want to be part of that health disparity because we know the numbers. So by us knowing the numbers, we said, okay, we don't know enough about the vaccine, but at this point, we think that based on the numbers that we do have, it will behoove us to take the vaccine and reduce the risk, not eliminate the risk of getting infected, but reduce the risk of the effects of becoming infected. And so that's why we took the vaccine. And I'll tell you, when I first heard about the vaccine, I said to my husband, if I'm forced to take the vaccine, I'm going to Suriname, which some of you may know, it's 80% rainforest. I will run into the bush. I'm hiding. You will not force me. And this is from a person who's an educated woman, worked on Capitol Hill with a doctorate in public health. I wasn't going to do it, but I was looking at the past. All the things that the previous speakers were talking about, I was looking at those, and they're absolutely valid, and I agree with everything. But what I recognize also why there's a hesitancy among the people of color now is there are other things that we're not necessarily looking at. It's not only healthcare, it's those factors that create our health outcomes. And I think that if the governments particularly start becoming a little more honest and looking at those things, then they will recognize that we can't just offer people vaccines and think that this is great. We have to offer them more than just the vaccine. We have to see what the needs are of the people for real, not just about protecting myself from the risk of getting COVID. Because all the people are saying is that I have more than just COVID to think about. In the ghettos, people are saying, well, I can take the COVID vaccine, but I can step outside of my door and I can get shot by a bullet. Is the vaccine going to help me with that? My housing condition right now, is what they're saying, is not such that you can protect me from dying. I can die sooner from stepping outside of my door than I can die from COVID. So I'll take my chances. And so with those kinds of rationing in mind, I oftentimes question the leadership and I ask them, have you spoken to the people who matter in this case? Because we can sit here and write policies and try to open up doors and give people access to healthcare. But if we don't talk to people about their needs for health, we're still going to miss the point. And we're not going to get rid of the hesitancy. And we're not going to be able to convince people to do the same things that we did. So that's really what I have, because all the other points were made before and I love them. So thank you very much. And again, thank you for having me on.